Hello, I'm Dr. Nicholas Cohen, and I'm here to share with you a top 10 list for preventing and treating speech delay in children. Tip number 1 is the best way to prevent speech delay is to read to your child every night. So pick up a book each night and read to your child. Tip number 2, when you're reading to your child, make reading interactive. So instead of just having your child listen to the story, stop at every page and ask the child questions about the story. What's that? That's an elephant. What color is that? That's yellow. Tip number 3, teach your child to tell you what he or she wants instead of just having them get what they want by pointing to it or making grunting sounds. Tip number 4 is narrate daily activities. So when you're with your child and you're going to the grocery store, instead of just going to the grocery store, you can say, we're going to the grocery store. Now we're walking down the street. Now we're looking for a bowl cereal. Tip number 5 is limit television watching to 1 hour a day. So television watching would seem like a good way for your child to learn how to speak, but in fact it just leaves your child passive and listening. So television watching is not helpful in helping your child learn to speak. So limit television watching to 1 hour each day. Tip number 6, make sure your child is being seen by your doctor for all well-child checks. Well-child checks are an important way for your doctor to find out if your child has a speech delay, and an important time for you to tell your doctor if you have concerns about speech delay. Tip number 7 is know the red flags for speech delay. Specifically, 2 very important ones are by age 12, your child should be able to call mama and dada for each of their parents. And by age 2, your child should know at least 50 words and should be able to put 2 words together to make a meaningful statement, like red horse or brown horse or chocolate ice cream. If there is concern about hearing delay, this is tip number 8. Make sure your child has a hearing test done. Make sure your child's blood level is checked for anemia, and make sure your child is screened for lead poisoning. Hearing loss, anemia, and lead poisoning are 3 of the most common reasons for children to have speech delay. Tip number 9. If a hearing problem is identified, it's important to act fast and early, to have your child referred to a specialist, and to get your child from their school and from the state all resources that are available to help your child catch up. And tip number 10, believe in yourself. Speech delay is a challenge that is very common and can easily be addressed with some of the tips that I've just mentioned. So I hope this has been helpful. Thank you for listening and have a great day.